go.
Great, and you can go to the next slide. So a little bit. I'm just going to introduce myself. My name is Lauren, and I am the occupational therapist at Hudson Physical Therapy Clinic. I work alongside 3 great, amazing physical therapists. We work together at Hudson PT. It's actually right down the hall in the Century building. I'm the occupational therapist, and many people ask what I do for a living. So I'm very similar to a physical therapist. I work with a patient to help them get that, improve their injury, their disability, decreasing pain, improving range of motion and strength. And I do this alongside the physical therapist. Generally speaking, OTs tend to work on the upper extremity, the shoulder, the elbow, the hand. So I see a lot of patients with osteoarthritis in the hand. And
Sorry.
that's okay. And Dr. Gleb is going to be, as the physical therapist, he sees a lot of patients with osteoarthritis in the hip and knee. And the second half of the presentation will be about the osteoarthritis in the knee. So an overview of what I'm going to be talking about. What is osteoarthritis, how it affects your daily life, and ways that OT and PT can help manage pain and prevent further joint damage. So what is osteoarthritis? Now, there's a lot of different types of arthritis. The one I'm referring to is osteoarthritis. It's different than rheumatoid arthritis, which is where the immune system attacks the joints, the lining on the joints. You can click, sorry. I'm going to give you a sample of what osteoarthritis looks like. So in the joints, we have cartilage between, in the joints, we have cartilage that sits between the bones, and it cushions and it lubricates those joints. And osteoarthritis is the wear and tear arthritis. It's a chronic condition in which the cartilage wears away over time. And as it does, the bones rub against each other, causing irritation, pain, inflammation, stiffness, and reduced range of motion. So while OA, osteoarthritis, can affect any joint, it does affect the hands a lot. Next slide, please. So there are some trademark signs of osteoarthritis in the hand. Due to the loss of cartilage, there can be swelling, making the appearance of large misshapen fingers, bone shifting and fusion, and certain nodes at certain joints in the fingers. The next slide, please. In some cases, the ligaments can be loosened, and there's in some severe cases, joint instability, and even subluxation, which is dislocation. Picture, please. Yes, so commonly, osteoarthritis is commonly found at this one joint at the base of the thumb called the CMC joint, carpo-metacarpal joint. It's between the carpal bones in the wrist and the metacarpal bone in the thumb. So why does arthritis happen at this joint in particular? Why is it so common here? Well, it's because we do a lot of things with our thumbs every day, texting, pinching, gripping. And when we're young, we don't normally notice pain, and we develop bad habits over time that put our thumbs in an unstable position. Next picture, please. And this is a good example. Oh, sorry. Oh, that was a good example of a picture of the joint deformity at the thumb. There we go. Is that better? Yes. Joint deformity at the thumb CMC joint. Can we save questions to the end? Okay. Got it. All right, next slide, please. So cartilage wears down over time based on a few factors, the most obvious one being what we do in our daily lives. The longer you've been alive, the more activity you've endured, and the more bad positional habits you create. Other factors include gender. I'm so sorry, women, but 1 in 2 women will get arthritis in the hand by the age of 85, studies show, and it's about 1 in 4 in men by the age of 85. So this is a very common causational factor. Other factors include a traumatic incident, or depending on what you do, or what your occupation is, if you're a construction worker, if you are an athlete and you've sustained a lot of injuries over time. Also, obesity is a causational factor, and an inflammatory condition like gout or diabetes. Next slide. So hand arthritis causes difficulty in many areas in our daily life. It affects everything that involves the hands, from brushing the teeth to opening clothing fasteners to cooking, turning doorknobs, and it'll even interfere with daily life things that you love, hobbies you love, painting, knitting. So to wake up in the morning and experience this pain, and also not to be able to do the things you love, but no wonder why people are getting so depressed and upset over this debilitating this slide. So as OTs, what do we do? So unfortunately at this time, there is no cure to bring back that lost cartilage, but there are some treatments. There's steroid injections. It'll temporarily decrease the pain. Surgical options like joint alignment and fusion and replacement, but those surgeries are more they work well for shoulders and hips, but in terms of the smaller joints like the fingers, not so successful. And before going down a more invasive route, OT and PT provide conservative ways to manage this pain and further prevent joint cartilage damage. Next slide. So, as therapists, we develop a pain management routine around your daily schedule. We tailor it to your schedule. Sometimes the patient can be triggered by something, stress or infection, even change in the atmosphere, the pressure atmosphere, cold weather. And sometimes they get what's called a flare-up in this arthritic joint. So if you can click, I'm going to show you an example of what we do for pain. So in a flare-up, phase, the joint might be very swollen, very hot, very achy. So this is where ice would be helpful to relieve some of that inflammation. Also, next please. We use in the clinic contrast baths. So we start with hot water, about 100 degrees Fahrenheit for a couple minutes. Then go back to cold water and alternate 4 or 5 times. This also reduces inflammation. It's important to rest the joints by perhaps using a splint at night. And I'm going to demonstrate on what a splint looks like and more about it in a few slides. And we'll discuss this in further detail. However, it's important. The most important thing is to continue practicing and performing really gentle range of motion, pain-free range of motion exercises. Also, of course, it's helpful to consult with your physician for pain medication over the counter or prescription NSAIDs for the pain. Next. Now, if the joint, again, quick time, one more time. So if the joint is not in flare-up, if it's just like regular achiness in the morning, then heat tends to feel good on these muscles. It tends to warm up the tissues, making it easier to mobilize later on. I use a paraffin wax in the clinic. The patients tend to like it. The wax gets into those little crevices that sit between the fingers, coating all the surfaces. So we use paraffin in the clinic. I also use moist hot packs. And if you click one more time, you can find one more. Yeah, one more. Sorry, you can find. You can purchase these online. This brand happens to be Medivise, but you can stick in the microwave, make it warm if you like, to relieve some of that pain. And as therapists, we're also licensed to provide temporary pain relief with other modalities, such as ultrasound. It's a machine that sends sends heat deep to the muscles and the tendons. Another one is the electrical stimulation. And it transmits electrical impulses to the muscles to frequently contract and relax, and it strengthens repairing these tissues and improving blood circulation. It's another pain modality. Just some food for thought, no pun intended, but there are some foods like dairy, gluten, they say nightshade vegetables, which is like eggplant, peppers, tomatoes, which trigger inflammation. So pay attention to what food groups you're eating and how it makes you feel. And you can always do what's called an elimination diet to figure out what's causing your inflammation. That's just some food for thought. Okay, so also in OT, I do a lot of joint conservation and energy education. I tend to compare our body like an energy balance bank account. All the activities we do throughout the day add up to create pain, fatigue, irritation. Every day we wake up with a clean start. We have a full energy balance with us, and every little thing we do, from brushing our teeth to opening the doorknobs to every little thing we don't even think about, those activities subtract from your original energy balance. And if you're overusing joints in any unhealthy way, you'll end up with no energy left over. So we need to figure out ways to avoid energy depletion and leave you with more energy left over for the things you love. So in order to do that, we follow 3 basic rules. The first one is respecting pain and understanding your pain threshold and balancing work and rest and activity. Click again, 2 more times, 1, 2. Just a cute little picture of that. So plan activities for peak energy times, such as in the morning when you're more wide awake or when your medication sets in, and alternate between light and heavy activities and plan rest and stretching breaks and avoid staying in one position for too long. So an example of a chore-filled day, you wake up and let's say you have last night's dishes soaked in the sink that were sitting overnight, so that you don't have to do a deep soak in the morning and you don't have to put too much pressure on your joints. So you wake up, you do the dishes, you wash half the dishes, let them air dry instead of towel dry, make a phone call while seated, then you go back and wash the other half of the dishes, then maybe listen to some music, make lunch, read a book, fold laundry, watch TV, and then put the laundry away. So there's this, just an example of alternating rest and activity. Next. Okay, so using proper body mechanics is true for everybody, but it's crucial for patients with arthritis. It's imperative to work smarter, not harder. So you want to use the stronger, larger joints in your body to, in order to protect smaller, weaker ones. So using the shoulder, elbow and to protect the smaller joints like the fingers. So I have some ideas I'm going to share with you where you distribute weight and load more evenly throughout your body. For the sake of time, I'm only going to give you a few examples, but I have a handout of detailed handout of all of them. Okay. First one. Okay, so if the cup is not too hot, you want to hold with the whole palm of your hand, not the fingers at the handle. Click. And if you do have to lift, maybe support the bottom of the mug, the base of the mug with your flat palm. Next. Okay, a little bit awkward because this is a tea kettle and it's hot. So I wouldn't recommend putting your hand on a hot tea kettle, but just as an example, instead of lifting with the fingers, you would slide with the whole hand or your arm. Next. Sorry, the image is a little bit fuzzy, but it's when lifting heavy pans. Again, put a flat palm under that base. You can even use an oven mitt to keep your fingers straight. And avoid pinching by maybe holding a stack of papers or a book with both flat palms under the base. Or like if you're reading a book, you can lay the book flat on top of the pillow on your lap so you're not holding it between the fingers. And when you do carry it, when you carry something heavy, hold it close to your body so that the weight is better supported by your arms. Next. Okay, wear a backpack with shoulder straps, perhaps instead of a briefcase. Carry when you're going shopping, carry the grocery bag over the elbow or the forearm instead of gripping it with the fingers. Okay, this one's important too. Avoid direct pressure to these knuckles. So when you're getting up out of bed, click again, or when you're getting out of a chair, use the heel of your hands, both hands to push when you stand up. Okay, next one. To open a screw top, spread the palm over the cover and use your body weight and turn the lid with a shoulder rotation. If you have to twist with the cat, then you're going to twist towards the thumb, not the ring finger. Okay, next one. Okay, for wing faucets, use your palm to push the lever on and the back of your hand to push the lever off. You're sensing a trend here, right? Like you're using palms, you're using wider surface areas instead of the finger joints. Okay, last one. Okay, if you do have to pinch with your fingers, with your thumb, like if you're pinching snaps or buttons, what I want you to be mindful of is ensuring good alignment. So having a nice open web space right here, almost as if you're making an O. Not this, so make an O. And that will help maintain the joint alignment. This one. Okay. Third, another way to reduce task effort is to use assistive devices to protect the joints. There's a ton on the market, and I'm not here to overwhelm you with them. It's more, think about what would be helpful for you and what you tend to do every day. So do you cook a lot in the kitchen? Do you have a little bit of money to spend? If so, invest in a rocker knife, which I'll show you on the screen. And that will give you more joint energy, so to speak, to do the things you love throughout the day. I have my student Tasha here. She's going to demonstrate some of the tools that we brought. So you can click and I'll show you the first example, and we can pass them around, or at the end you can take a look at them. So Tasha, if you could hold up the built-up handle grips for the cutlery. So I don't have the thick foam, but you can purchase this online. It's foam padding. It's tube shaped. You can put it on any type of utensil or hairbrush, cooking utensil, and it takes the smaller joints off. It takes the pressure off the smaller joints of the thumb and the hand.
Okay.
And you can click the next one. She's passing around a universal cup, and wearing it allows you to keep your fingers straight when holding the utensil. Okay, next one. Okay, this one is really cool. It's called a button hook, and the wire end slides through the buttonhole and it loops around the button to pull it through the hole. And this is so you avoid pinching with your fingers. It just relieves some of that joint pain. And it also, really cool thing about this one, on the other end of the handle is a wire hook, a small narrow hook, and it slides into most zippers, so you don't have to pinch.
Oh, can you just show?
Yeah,
I'm just going to stop share for a second so you could just show people online how that works.
Yeah, sure. Here, here's the camera. Yeah, it's really cool. You know, I'm sharing all these links. I have them on a handout, hand copy handout, and also online. They're available online actually, with the links.
There we go. Perfect.
All right, so
Thank you.
Next one is it's difficult for anybody at any age to open jars. This has been my biggest frustration my whole life, sure for you too. I still have this problem, but there's a lot available online. You can use a gripper pad. I'm sure you've seen these around. If you use a gripper pad, what you want to do, like I was explaining before, is use the palm of the hand and twist by keeping the fingers straight, and use your shoulder to turn. Use the pressure of your shoulder instead of the joints in the fingers. Next. Oops. This is a really cute bottle opener I found. It's magnetic. You can put it on the fridge, and it has different sizes for different lids. So got for glass bottles, soda cans, full tab cans, and this bottle opener. That's off the lid of the bottle.
That jar opener is very important.
Exactly. Yes. So the next one. Here's another jar opener, and it's designed for different size lids too, similar to the one I was showing you before. There's a lot on the market. Some of it works. I was doing it on different bottles myself. Some of it works, some of it doesn't. You have to play around with it. I found that this one was actually more helpful, but it's a smaller size. Yeah. Next. So this is the rocker knife I was telling you about, and I really, really recommend this one. Rather than using a diagonal knife grasp where you're putting all the pressure on their thumb, putting force on that thumb, it distributes the force evenly along the whole hand. So this is a really good ergonomic tool. I highly recommend it. And I provided a link in the handout. Next. This one is great too. Adaptive cutting board. It reduces the amount of force needed to hold on to the food item, and it's for safety too. So you put the food on the nail pegs, or you use the ledge, and it helps hold it into place. Next. So, okay. I often recommend orthotics because they are used to rest and support painful joints, maintain correct alignment, and improve functional control. So if I have a patient coming into the clinic complaining of gripping, pinching activities, or I notice that he demonstrates poor mechanics, such as on the left, where he's not making a rounded web space, and I see his IP joint right here, and the thumb is hyperextended, that leads me to believe, okay, we have poor joint stability. Let's try an orthotic brace. So my student, Tashna is also going to show, you can click on the next slide. Oh, okay, yeah. We're going to show you some braces that provide support. This is a thumb spica splint, also known as a short thumb opponent splint. This one in particular, I like. It's rubber latex, it can get wet. It provides a little bit of support in that thumb CMC joint, but also allows the thumb to be mobile, so you can be active throughout the day. And then if you click on the next one, this one is provides more, actually maximum support. It immobilizes that thumb joint. And I recommend this one at night because sometimes we toss and turn in our sleep, we roll onto our hand, or we sleep in a very clenched fist. So it prevents that thumb from going into a clenched pose. So a huge part of my therapy session is movement. Because remember, motion is lotion, and exercising is important in the joints to keep them lubricated and healthy. And evidence confirms that exercise stimulates blood flow and promotes body healing. So this is another big one that we do in our sessions. I tend to start my sessions off with a massage to loosen up any tight muscles. There is this one tight muscle that sits in the base of the thumb that goes around that joint. It's very, very, very tight. And it's tight because we use our thumbs, like I said, all day long. We're pinching, we're texting, and it's a very tight web space. So I'll massage it, or I'll even use, like, you know, those snack chip clip that, you know, you put on the snack bags. So I put that on the patient for a few minutes, and that tends to relieve some of the pressure, some of the tightness. Okay. I also apply joint mobilization to tight joints, such as the thumb, and this improves vascular flow, and improves range of motion. And not to overwhelm you, these are just the different planes of motion for the hands and the fingers. I have a handout, a nice simple handout on exercises you can do. But I encourage my patients to practice their full range of motion without pain. So I'm going to provide that handout for you. I also encourage my patients to do these exercises in the shower where it's nice and warm. It warms up the muscles. Okay, next. I have another handout that goes through tendon gliding exercises. This is for the flexor tendons that go through the carpal tunnel in the wrist. And doing these lubricates those tendons, and it prevents the fingers from becoming stiff. So that's also a handout for you guys. If you experience any pain with any of these positions, you stop doing them, but it's important to do them every single day. Next. Almost done, guys. With the patient, once his pain lessens, we begin lightly strengthening the muscles that sit around. Again, I'm talking about the thumb CMC joint. So we strengthen the muscles that sit around this joint. If the muscles and the ligaments are weak, such as these muscles here, then the joint will continue to be at risk for dislocation and deformity. Quick. So I tend to use rubber bands in my sessions because it's good to. They're very graded. There's different colors depending on the resistance, and I always start with low resistance, and then we build our way up. So here we have a patient working on lifting and lowering his thumb from the base, going against rubber band resistance. So that works these muscles. You can click. In this one, the patient is making a rounded C shape against band resistance to work those muscles. Okay, you can click again. And then there's studies that show that there is another. Yes, there's another intrinsic muscle that sits in the hand, and it sits adjacent to the index finger, and it also to strengthen it will also support the thumb. So again, the patient is doing exercise against resistance band. Okay. We also use therapy in the clinic, which is like the rubber band has different levels of resistance. We use these for isometric exercises, such as building pincher strength in the top left. And I'm always informing the patient to make sure that the web space is nice and rounded. Yeah. And the last one, okay. So I also want to maintain good rounded web space with a simple exercise in muscular re-education. Patient holding a tennis ball or a small ball, and they raise and lower, they practice raise and lowering their thumb. Okay, and to make sure the thumb stays nice and rounded. Okay, we can go to the next slide. And you can just keep clicking. These are just different types of tools. You can click again. Other tools we use in the clinic to help build up strength and promote joint re-education. You can keep clicking. There's just a lot of tools we have in the clinic. Yep.
Okay.
And yeah. And I hope you obtain some useful information about osteoarthritis in the hand. My card is there if you have any other questions. You know, we're here to help you get through this pain. I know it's not easy. It's a struggle, and yeah, we're here to help. And my colleague, Dr. Gleb, is going to talk about osteoarthritis, particularly in the knee.
Oh, you can the lavalier.
Yeah.
One.
I think can just test us, make sure people can hear you, or maybe just clip it a little higher up.
One. One.
Yeah.
Okay.
Now we're good.
Hello, everybody. My name is Dr. Kartsev. I'm a physical therapist at Hudson Physical Therapy and born in St. Lauren. Thank you all for the presentation. And today I'm going to be speaking about the knee arthritis. So as Lauren already mentioned, that we can click to the next slide. There's a lot of different types of arthritis. There's about 100 of different types. Most of the ones that we hear is osteoarthritis, as already was mentioned, is the cartilage, and affecting the cartilage that protects the end of the bone being affected. Sometimes it's wear tear, and the other one that we know a lot of, rheumatoid arthritis, that's an autoimmune response. So there's some pictures here in the presentation when you have the osteoarthritis presentation, for example. You see all the cartilage is being eaten out by the inflammation, and it's very poorly recovered. Like cartilage, due to lack of blood flow, it's poorly recovered. Another specific thing about the joints, most of the joints, the big joints that suffer osteoarthritis are synovial joints. That's joints that have a thick capsule, like you imagine, like wrapped in a thick plastic joint. So the whole thing is going to be wrapped in a thick white substance, that like a plastic bag, basically. And all this recovery, all the nutrition supply happens in the joint just by that capsule generating synovial fluid. It's a thick gel-like substance that basically, like an oil in an engine, wraps everything around, covers everything around, making sure everything is gliding and sleek. So that's the only way how the joint is receiving the nutrients that helps it to recover. That there's no blood vessels like we know, like a muscle has. Therefore, recovery is so problematic for the cartilage, and it's very, very slow. There's going to be few articles that I'm going to reference at the end, and I will tell you about the time frames. Therefore, that affects the recovery. That some people may say, hey, I went to PT, I went to this doctor or that doctor, I spent like 10 visits and I don't see big change. Like I said, there's no blood vessels, there's nothing like that. It all happens slow, and it only happens with the motion. That's why you hear that Lauren already mentioned it, motion is lotion. So imagine it, you're greasing it, and you put the nutrients all around the area that's being used throughout that area. So that actually delivers nutrients and helps to fight all of these red spots of inflammation. And what else I wanted to mention about this? What can cause about that? What can cause this? How to avoid it, or what's happening? So most of the contributing factors: old age, obesity, prior knee injuries, certain occupations like sports, like heavy abuse of the body, As was mentioned before the start of the presentation, it just has to be female, more prevalent to have it, and it's like terrible. Genetics, yet still there's more little and more factors as well. Smoking, like lifestyle, all of that affects sedentary style. So if you're sitting or most of the day have very little motion, that already alone will not help or assist your knee. Your joints has to move in order to be greased up and well nicely maintained. Okay, we can move on to the next slide. And there's different stages. Different stages of the osteoarthritis as well are like the 4 stages from beginning, whereas like 0 stages, nothing, basically joint is healthy. Stage 1, it's like minor changes. You can see something interference on the MRI, because MRI usually can be the one that's going to show something like that at that position. Because when you see it on the X-ray, that we're talking on stage 3 or 4, that's already where the ossified formation happening, where the changes in the joint happening, and they can be seen already on the X-ray. MRI is more for the earlier stages. What also you can experience with that is the pain, stiffness. We're going to talk more about that. And also what we do for the work with arthritis. It's a physical therapy. We're going to be talking more and more about this. It's also assistive devices that Lauren had a great presentation for everyday use, because hands like doing so much, therefore so much assistive devices, it's like almost countless. For the legs, we have different things, how we can approach it with the changes of the shoe wear, with using a cane, different types of cane or support, as well of maybe a wheelchair if it's the time to use it. All of that done to maintain the proper use of the joint, not to just stabilize it and not to move it. That's the worst decision that can be chosen, but to make sure, hey, we can squeeze out every possible % on the recovery that we can do from that joint. Weight loss, because some people who's obese, that's another thing that's abuse on the joint, that's basically heavy carrying for the joint, that's also prevents it from healing. Therefore, looking what you eat, it's another thing that helps. As it was mentioned before, we're suggesting sometimes nutritional consultations for you to balance out, because sometimes, hey, I don't know what to change. I don't know what's healthy, what's not. I think one thing is healthy, but yet too many of the good thing is also not good. So there's a lot of things to know, and it's understandable if you cannot observe all of that knowledge. It's simply constant talking, constant discussions about things, and keep in mind things are changing. Something that was okay 10 years ago, it's not okay right now. Something that was okay when you were 45, it's not okay when you're 60. So all of this thing changes, and therefore we need to consult the things, how you utilize your body throughout the day is also important. So that's what we can give you recommendations about. Alternative methods is basically medication. New research is coming up about medications, and they seeing different things. So speak with your physician, speak with your ortho, see what medications are good, what's not, because some of them side effects can affect your joints healing and joints pain. Joints injections, as was mentioned, on corticosteroids or hyaluronic acid, it mimics that glue. Some people we have good results, but usually with combinations of movement and everything. But it's needed to be supported. In addition to that surgery, we also do post-surgical recovery as well. Some people getting to the point where it's like, hey, they did everything they could. They came to the stage that surgery has to be done. And usually we even start before the surgery. Somebody who's able to do it, we start before the surgery. That most of the time gives us easier rehab, shorter times, and less pain. If your muscles are healthier before you go surgery goes usually smoother. Next slide. By the way, a little spoiler, somebody who's most active with the questions is going to get the t-shirt at the end. So think about questions if you have any.
Including online.
Including online. Thank you, everybody. As some of that was mentioned already, what's lifestyle changing needed to be done? Because it's not only, hey, I'm going to go to physical therapy, they're going to do everything for me, and I will have to do nothing at home. not that easy. Unfortunately, like it means you have to change things in your life. When people actually agree to do some minor, we're not talking, hey, I'm gonna turn my life 360 and gonna live new life. No, we're gonna say minor changes, adaptations, they have the most result. When you don't do your homework, we see it. We see how you progress. People who's exercising, who do their homework, they usually progress faster. Who doesn't, takes longer time. The pain after they done PT or OT, they come back, oh, it started to hurt like 3 months from that time that I stopped. Or usually people who maintain it, they come back once a year or they come back for the other problem. So that's also keep in mind that it's very individual, but the more you're involved when you're not in the office with a PT, the better your results. So that is extremely important. But avoiding activities that put exercise stress on the knee joint. We teach you which activities are okay, which are not. Because as we said, you have to move. Sitting, not moving because it hurts is not the active. It's a failure. Using assistive devices as needed. All of some of them can be doing too much of the support. I see frequently people coming with the braces when they shouldn't use it because brace take out some stress from the body and then muscle relaxes. Body is very efficient machine, but it relaxes and like, okay, why keep this muscle this big if I can save my energy and make it smaller and that's it. But then you take off the brace, you need buckles. People trip. So those things have to be properly used. You cannot just say, oh, commercial said knee hurts, put the brace on. You can't. This is not not that easy, and all of them saying, hey, consult your doctor. So we one of the doctors that you can consult about if you need it or not. Engaging low impact exercises. You see like two things like almost contradicting, but there's good exercises, there's bad exercises. Good exercises for me, maybe not good for you, and vice versa. So everything has to be balanced. It's not just a simple squat. I can have 5 different reasons for each person who does the some exercise for the knee, and they're going to be hitting different goals. Yet they're going to be, if you're going to look from the side, they're going to do the same thing. But there's reasoning for this is different. Therefore, progression will be different. Next slide. And basically, what does science say about the how physical therapy works? Same goes for the occupational therapies. In this marks, you can follow the links right behind right under the passages, and you can find the full articles. Most of them are a high level, like trustworthiness. It's a meta-analysis, clinical trials. A meta-analysis basically when the bunch of different studies being taken together, analyzed, and results are driven from that. So one of the things, improved functional mobility, that's what's the study published in Journal of Geriatric Physical Therapy in 2010 found that physical therapy was effective in improving knee functions and mobility in people with knee osteoarthritis, but it took 12 weeks. So it didn't happen the day after. So as I said, recovery takes time. Muscle, usually you're gonna start feeling, hey, I feel stronger today, but it hurts tomorrow. You're gonna go through those sore and ache pains. The muscle have to grow. The body grows, the body recovers, regardless of you 15 or 80. The difference is the rate that it recovers. If before you were able to jump around at 20 and work and next day refresh, right now you do something more out of normal, you broken for 2 days. It's different tones, different body, but it all works out. We guide you through that path to find your good, sweet point. Reduction of pain, a systematic review, that's what I said, the combination of multiple studies, not just one group. And meta-analysis published in Physical Therapy 2017 found that physical therapy was effective in reducing pain in people with knee OA. Found that physical therapy interventions such as exercises, manual therapy, and electrotherapy led to significant reduction in pain compared to control groups. We do manual and we do exercises with balance out. Sometimes maybe in the beginning you're going to be more manual, more or less exercises, some modalities like electricity, ultrasound that was mentioned before, or heat. Sometimes we changing the balances. So in order to make it effective for you, different times you need different days. Improved quality of life. Study published in Journal Geriatric Physical Therapy. We saw it in the first study in 2013 found that physical therapy was effective in improving the quality of life in people with EOA. Study reported that physical therapy intervention, including exercises, manual education is basically we tell you what to do at home, how to perform certain things, led significant improvement in quality of life measures. So they using, in order, when they say quality of life, it's basically big questionnaires that touch every point of your life, like how you go through the day, and they do the basic score and they compare. Improving in the score, we have improved. Okay, next slide. There's two more studies. Increased muscle strength. So as I said, you can, doesn't matter of your age, you can build up muscles. And there's tons of the research, but it takes time. This study is actually found that physical therapy was effective in increasing muscle strength in people with EOA. Study reported significant improvements in quadriceps and hamstring strength. Quadriceps is the front of the thigh, and hamstring is the back of the thigh. It's the main muscle that actually work and move your knee. But it's also it took 12 weeks. So you see, nothing happened in a week, nothing happened overnight. It's work. It's never easy, but we guide you through it to make it easy. All right. Last study reduces knee. No problem. Can we go back? That comes. Reduces need for knee replacement surgery. What does it mean? It doesn't mean that hey, everything is heals and we sitting on the yeah. It's actually no. It's basically people who has stage 3 arthritis. They find a way and activity that hey, I actually can meet my daily needs. I can do everything I need with this support, and I don't need to go on surgery. So for some people, definitely an exit because they might have other comorbidities that affects their body that they can be like additional risk for surgical recovery or for the surgery itself. So there's the ways how you can work, and that's significant enough to make sure that people that meeting their goal that they need without the surgery. And the next slide. And thank you very much. Thank you, the public and the internet. Thank you, everybody. Please bring up your questions, and we're gonna be happy to answer all of them.
So does.
Yes.
Yeah, the question was, can you get handouts? So yes, they have handouts in the front. And I can, for anybody online, I can email, let me know, go to info@rssny.org and we'll be happy to send you the information at the same time.
Okay, I have a question.
I
have a question. Hello?
Yeah.
Can you hear me? Okay. What's the jury saying about glucosamine chondroitin for pain, osteoarthritis, and cartilage regeneration or whatever?
I'm sorry, could you repeat the question?
It is a supplement that has been popular. Glucosamine.
Oh, glucosamine.
MSN.
I know what you're talking about. So usually disclaimer, we do not prescribe the medication or supplements, but from what I know that the patient used and also study indicated, the supplements not really improving the recovery, but they do support the joints. They do support the joints. When they looked from the research, when they looked into stage 3 and 4, later stages when there's a big involvement of the OA, people from the reports that people that I worked with, they felt easier, but there's no indication that it helped to recover the cartilage itself.
So it's some relief. Yeah.
So there's some relief. Different people respond differently. Some people, hey, I feel very much better. For my mom, she took it. She has sometimes like seasonal inflammation. She takes supplement for the knee, and she feels better. But it's very, very individual. Always those supplements, you have to make sure you speak with your physicians that you're not overtaking. Same as calcium, you cannot just decide to take something and keep doing it. Just make sure you consult with your physician before you take it. But some effects are happening, and it's usually on the pain reducing side versus recovery of the part.
Yes, and tea also have Hudson. Hudson is an adaptogen.
Yeah.
And it gets rid of the inflammation, and it's helps the arthritis pain. Hudson.
Yeah.
T-U-L-S-I, from India.
Okay, Robert, I think you had a question next?
Doctor, when do you decide, when you use all your therapies and your physical therapy and your exercise, that you find that the life situation isn't working and you have muscular
So just to repeat real fast so people can hear is that at some point, if you're doing the therapy, at what point do you find that maybe it's not enough and that you need to resort to surgery?
At this point, we guide you through the program. If we see that you plateau and we did not resolve the pain that you have, or you still have significant pain that prevents you from returning to your lifestyle, we also recommend the orthopedic consultation. And that's going to be on the orthopedist who's going to let orthopedic surgeon to decide if you good for the surgery or not, because they might have other reservations due to state of your health. But we're going to be open with you. Hey, we hit the plateau. We're not moving. What do you want to do? Do you want us to switch? Do you want to take a break? Would you like to take a consultation to orthopedic? Rarely happening, but does happen in cases, and that's usually how we have.
Thank you.
You're welcome.
I think somebody here had a question and then next.
Yes, please. Are there certain foods that cause inflammation?
So are there certain foods that cause inflammation?
Yes, yes.
Yes, and Lauren mentioned that it was nightshades.
Yeah, certain dairy products, gluten, like pasta, rice, pepper.
Tomatoes,
Yeah, nightshade vegetables, eggplant, tomatoes, peppers. Said eggplant, I think white potatoes too.
Yeah.
Gluten and dairy, of course, as well.
And sugar.
And sugar.
And sugar.
That's it.
Everything I like.
Okay.
and you have problems with
Oh.
On my phone, with the focus record, I think I've done it. I was doing it. It's probably easy to say, so alternative to focus. This is what I can give you shots of the hyaluronic acid. That worked. And I went to, I just really not to stay home a week apart. And that worked, along with exercise, it was something on that I exercise every day. Surrounding muscles, like you mentioned, the quads, hamstring, every part of my leg, I exercise on a daily basis. And along with the hyaluronic acid, I'm fine.
Do you have a
All right, but you,
You have to do hyaluronic side.
Your parents, I first started, I did it 1 year, and then it lasted for about a year and a half. Then I did it again, it lasted 2 years. But in the interim, I was doing the exercise. So the doctor was saying, you need to stretch your whole body. So I think, so the last time I used the hyaluronic acid was, I would say, more than 3 years ago. So it's been implemented, things from what I want to do about it. And of course, I find that chemical MSF and that's fine. And avoiding the night shift.
right. So what you're saying is that you did a whole series of things between the supplements, the exercise, the hydrochloric acid. Oh, so that's good. So do we have anybody online who has a question? Another question? You have one lady? Yes. I see somebody raised her hand. You're on, I think you're on mute.
Okay, I was wondering, is there any pain medication for it? I've tried a few things, but I have such pain with my hip arthritis, and I do plan to be operated on, but I may or may not get clearance. So until then, I'm doing physical therapy, but sometimes I can't even do it because it hurts so much.
There are pain medications on a different level, but as I mentioned before, we do not prescribe the medications, and pain medications being prescribed differently. And we went through, in our practice, we have multiple hip replacements. And I know multiple stories before the hip replacement. Sometimes PT is actually the ones who refers to surgeon, because hip is tricky part. Sometimes they confuse it with the back pain, because back is also involved at the same time, and they, instead of having treatment for the head, they would be treated for the back. But nevertheless, pain medications prescribed very individually, therefore unfortunately cannot advise you on that. But there are pain medications, very different. There's tons of them. So speak to your physician or pain management if you would like a more specific answer.
Okay.
Okay, we have a question in the back. Go ahead.
I was wondering what your opinion of marijuana or shot or the cortisone shot, or also as to getting a good night's sleep.
All right, so the question is, what's your opinion on marijuana, cortisone shot, or good night's sleep?
Yes.
Good night's sleep is the best. Good night's sleep is the best. Cortisone shot is frequently used to knock out that initial inflammation. That is basically what people do. And usually, even before you're gonna get hyaluronic acid, you're gonna get the cortisone shot. Sometimes it works, but there's controversial research coming out about cortisone, because frequently after cortisone shots, people might have a tendon injury or so. Therefore, that's very specific about marijuana. Also, for some people, it works as a painkiller. Usually, it has to be medically prescribed and dosed properly. That's about it. What I can say for this one.
There's a few questions in the chat. Maybe?
Yes.
Oops, let me take a look. And yes, there is. Oh, there we go. I do. Oh, that's weird. All right, let me do it this way. And first one, will you send a list of these and where to buy it? So yes, that's going to be included. So just let us know if you want anything, and I can email that to you. Is there any pain relief medicine with hip arthritis? I think that was the question. Okay, so we're good.
I believe there was one more question. That's it.
No, I think that was it in the chat. Yeah. She had already.
Yeah, I asked that.
On the right side.
Yeah. Okay, so you're good. All right.
Any other questions?
Any other questions, either in the room or online? We're good? Okay.
Please grab a brochure, and thank you very much for coming. Just a quick disclosure, we're not getting paid or anything like this for the list you're gonna get. That's simply Lauren combined it to the way for your convenience, so you're not tied or bound to buy anything like that or specific. So
Thank
just a disclosure.
Very much.
No commission.
Thank you. All right. And then for everybody in the house, please don't forget to sign in.
In addition, just a quick word, we do work on maybe throughout the whole body, so neck, head, balance. We work with lymphedema or surgical recoveries. All details you can see in the brochure as well as when you have our card. Give us, if you have any pain or discomfort, just simply
Let's just finish.
Simply give us a call, and you will be paired up with a PT or OT who can help.
Thank you guys.
And do you need physician's orders?
Right now, you can start without physician order as long as you have a primary care physician. You can just walk in. you can start the therapy, and then within 10 visits, you may bring the prescription.
And you bill insurance directly?
Yes, we do work with the major Medicare, the same insurances. So that shouldn't be a problem. You can always give us a call. Usually what we do to avoid any possible surprises with our patients, if you give us a call and hey, saying I'm a new patient, I want to come in, you're going to speak with our lovely front desk. Her name is Emily, and she will take information and she will do eligibility. So she will call the insurance, speak with them. They will find out if there's deductible, if there's copay, and before your first visit, you're going to already know what your responsibilities are. Because usually we run the business no surprises, so we try not to surprise anybody with a surprise visit. And it's so far we've been successful.
Thank you.
Yeah, go. Okay, where are the offices? Oh, offices are located right upstairs, right over your head.
Century Building, Suite 121.
Suite, Century Building, Suite 121. Yeah. Okay. All right. I think we're good. All right, thank you, everybody, for coming.
Yeah.
Thank you.
Thank you.
Thank you.